So we've got these areas of identity, emotion regulation, emotional awareness, cognitive ability, my ability to think in more complex ways. That's actually worth understanding. There was a guy named Jean Piaget. Jean Piaget is one of the founders of developmental psychology. He was also an evolutionary biologist. He was a mathematician. He was a deep, brilliant man. Study Jean Piaget. And Jean Piaget spent huge parts of his life watching kids play. And what he was interested in was how human beings transform. That's what growth is. Growth is transformation. And he was particularly interested in the universal ways that human beings grow, learn, change, and transform at predictable periods under predictable circumstances. And so what he discovered was that human beings cross-culturally, cross-gender, grow in particular ways, right? So if you ask a 3-year-old to do multiplication, it's not going to happen. Around 4 or 5 years old, a kid can start to add up oranges. 1 orange plus 2 oranges, 1 is 2 oranges. 2 plus 2 is 4, right? They can do addition. You ask them to do mathematics, they actually don't have the structure of the mind, the capacity in that moment manifested to be able to do abstract math that doesn't operate as easily in things that you can grab and do. They're more complex, abstract mathematical terms. That's in every area of our life. And so development is having more complex and nuanced ways of interacting and thinking about the world as we grow older. So it's cognitive development. So we have all of these areas. We have cognitive development, emotional awareness, emotion regulation, identity, and then one that's rarely talked about by psychologists. It's very controversial, but it's at the core of being human, which is moral development. How I think about issues of right and wrong, and my understanding and my ability to articulate to myself why I think something is right and why I think something is wrong. And so in all of these areas, we can develop uniformly, and in all of these areas, we can become disordered. And what you'll find if you do some psychometric testing on people in the addiction population, or you do developmental testing in all of these areas, is you'll find that there are disturbances. In every single person coming into treatment, my parents actually, who are developmental psychologists, did a longitudinal study of 700 people coming into treatment, and all 700 people had an identifiable developmental disturbance outside of the norm of the population. It's the same kind of developmental disturbances that you see in the mentally ill populations and also the criminal populations. And as we know, there's great overlap between those populations. So part of recovery, if that's part and parcel of addiction, developmental disorders, then part and parcel of recovery is treating those developmental disorders. First, we have to be able to identify them. So people will say when somebody comes in, clearly you're stuck. And you can feel people, they're having issues when they come into treatment beyond addiction. But understanding what area they're stuck in, it's actually much more complex. And it's one of the areas I think is going to have massive development in treatment. Guess what? You're not stuck cognitively. You're stuck emotionally. Okay, how do we deal with that? Guess what? You're not stuck emotionally or cognitively. You're stuck in your identity and your vision of seeing yourself. And these areas are well researched in the field of psychology. And we even have therapeutic approaches to deal with them. What we haven't developed well is a method to identify and then treat that in the addiction population. That's what's happening right now. It's one of the things we do in our treatment program.